Hello, and welcome to our lecture on therapy. Psychodynamic therapy. The goal is to help people understand current symptoms, explore and gain perspective on a defended against thought or feeling. Some techniques, client-centered face-to-face meeting, exploring past relationship troubles, trying to understand the origins of the current difficulties. Psychodynamic therapy influenced by traditional psychoanalysts sort of but differs from it in many ways. It's loosely based. The differences are the lack of belief in ID, ego, and superego. It's briefer, less expensive, and more focused on helping clients find relief from their current symptoms. It helps clients understand how past relationships create themes that may be acted out in our present relationships. Behavior therapy. Behavior therapists are not insight therapists. Their goal is to apply learning principles to modify problem behaviors. Behavior therapy based on the assumption that maladaptive behavior has been learned and can therefore be unlearned. It focuses on a person's behavior as being the source of the problem rather than attempting to identify underlying personalities, repressed conflicts, or unconscious motives that are causing this maladaptive behavior. A couple ways to do this are exposure therapy. So behavioral techniques such as systematic desensitization in virtual reality exposure therapy that treat anxiety by doing that, exposing people. So this is typically an imaginary situation, but sometimes they do put them in actual situations. And again, it's to the things that they fear or try to avoid. There's systematic desensitization, which is a type of exposure therapy that associates a pleasant, relaxed state with gradually increasing anxiety triggering stimuli. It's commonly used to treat phobias. It was developed by Joseph Wolf to treat people who respond to specific stimulus situations with excessive anxiety or a fear of phobia. It was proceeded slowly and systematically is the key aspect to this therapy. It's again a good treatment for phobias. Operant conditioning therapies sort of also fall under behavior therapy. And this is consequences drive behavior. Voluntary behaviors are strong and they're influenced by their consequences. Behavior modification. The desired behavior is reinforced. The undesired behavior is not reinforced, but is sometimes punished. The positive reinforcement therapy technique is based on the fact that people behave in ways that produce positive consequences or reinforcers. It's a powerful tool for shaping behavior. It's far more powerful than punishment is. The token economy. People earn a token for exhibiting a desired behavior and can later exchange that token for a privilege or a treat. If you watch The Office, think of Schrute Bucks. That is exactly what he was trying to do. It's very successful in the treatment of various disorders such as autism, chronic schizophrenia, eating disorders, and even severe mood disorders. Cognitive therapies. These are approaches to therapy that are based on the premise that most behavioral disorders result from some sort of thought or cognition that's disoriented. Teach people new, more adaptive way of thinking based on the assumption that thoughts intervene between events and our emotional reactions. The primary models are Albert Ellis relation emotive therapy and Aaron Beck's cognitive reconstruction therapy or reconstructing therapy. Rational emotive therapy. This is an approach to therapy that is based on the premise that psychological problems result when people interpret their experiences based on self-defeating irrational beliefs. The therapist approach is to help people find flaws in their thinking, to challenge or dispute these maladaptive cognitions, and then to guide the client to substitute more logical or realistic thoughts. It's much more active and directive role than sort of analyzing or even the humanistic approach. Confrontation, persuasion, role playing, interpretation, behavior modification, and reflecting of feelings are some of those key aspects. Biological based treatments. These are based on two assumptions. One, the behavioral disorder results from a biological abnormality, including an altered brain structure and or altered brain chemistry. Two, psychological intervention through surgery, electric shock, or drug will alleviate or significantly treat symptoms of behavioral disorder. Cognitive reconstruction therapy. Cognitive therapy aims at restructuring irrational thinking patterns such as the tendency to use negative self-labels. Beck actually believes that people who do not value themselves tend to overgeneralize from their experiences and unconsciously seek out other experiences that will confirm their poor self-image. Self-defeating behaviors become a self-fulfilling prophecy. Beck's methods tend to be less confrontational than rational emotive and more experimental. A common strategy is for the therapist and client to make a list of the client's misguided self-impressions and then to agree on some experiments to test these assumptions. The therapist sets up the experiment that will disprove rather than confirm the client's negative self-image. The next is drug-based therapy. There is antipsychotic drugs, and these mimic certain neurotransmitters, so block or increase activity of dopamine. They reduce overreaction to the irrelevant stimulus. They can produce sluggishness, tremors, twitches, um, things of that nature. They are successfully used with life skills programs in family support when used to treat schizophrenia. Older medications may cause side effects, such as TD, where newer medications or atypical antipsychotics are equally as effective with far less movement related side effects. There's anti anxiety drugs, which depress CNS activity, so things like Xanax would be considered an anti anxiety drug. Used in combination with psychological therapy, may reduce symptoms without resolving the underlying problem. Withdrawal linked to increased anxiety and increased insomnia. So the drug they were looking to fix the problem, when they stop taking it, makes the problem worse. Having sort of a sedative and relaxing effect. Abuse liability potential is high and can result in severe withdrawal, especially for those that have prolonged use. Antidepressant drugs. This increase availability of serotonin and promotes birth of these new brain cells. SSRI uh, also includes, TCAs, MAOIs, serotonin, or SNRIs, also very effective sometimes, they're often questioned. And the reason for that is the sort of spontaneous recovery that a lot of people feel when they go on antidepressants. And of course, we talk then about the placebo effect does have, sort of throws our judgment on those type of therapies. There's also mood stabilizing medicine, and this controls manic episodes. There's also AEDs, lithium, which is often used to level out emotional highs and lows, typically in bipolar disorder. It's widely used, however, it has a narrow therapeutic window because of toxicity and effectiveness. Many therapists believe that using AEDs and antipsychotics over lithium, just due to the need to monitor lithium toxicity. Thank you so much. I hope you enjoyed the lecture.